Okay, so here in this slide, what you can see is infection control methods. Now, this is a great example of what it were to look like if you were to wear all of the personal protective equipment that is available for your use. So notice from the top to the bottom, the hair cover all the way down to the shoes. This individual is completely covered and not at risk for any type of workplace contamination. Mucous membranes are covered. Gloves are being worn. We have masks. We also have respirators, depending on what it is that we're dealing with. If this were something that were airborne, then of course a respirator would definitely be more beneficial than a typical mask. If you feel that you may be at risk for bodily fluids and coming in contact with your eyes, you have goggles. We also have face shields for that. To protect our clothing and protect our open skin, where we would always wear a gown. A long sleeve shirt underneath there is even better. And if you have a lab coat, even better. That gives you triple layer. But in any case, you want to use multiple types of personal protective equipment at all times, we wear gloves with all patients, and we wear our mask anytime that we're coming in contact with anybody that may place us at risk for anything that could be airborne or droplet related. But you could never have too much personal protective equipment on. So when in doubt, go ahead and put it on. Your worst case scenario is you're overdressed. Not a big deal. All right, so finishing up here, when we're talking about the order of our personal protective equipment, we have two terms here. You have what's called donning and you have doffing. Donning is placing your protective equipment on. Doffing is taking it off. And so notice here, when you're starting with your protective equipment, it starts with hand washing and sanitizing. You're going to start with your gown. The mask is applied, the eyewear is applied, and then lastly, the gloves are applied. Now, when we're taking our personal protective equipment off, we're going to think on the lines of being contaminated. So if we're contaminated, the first thing we want to do is take off the gloves. Once we remove the gloves, then we're going to remove the gown. Then we remove the eyewear, the mask, and then we end just the way we started with hand washing and sanitizing. That would be the order of PPE, and that would be donning and doffing.